So in the short steps, first is to identify the patient. This is to make sure that the patient who will be assessing. So
identify ang para ma-identify. Ikaw magkana sa iyang pangan or siya ay nag-state. Ikaw magkana sa iyang pangan or siya ay nag-state. Adi, I mean,
next is to I'll be explaining the procedure. So ma'am, procedures to detect unit underness, massage activities can be present in your abdomen and to prevent it from worsening. Then I'll be performing hand hygiene to avoid contamination. Then assess the patient.
contamination of what?
Then assess the patient to undress if needed and provide the patient's gown. Then assess the patient has to find his Then expose the abdomen. Then make sure to provide privacy. In assessing the abdomen, first thing we need to do is to inspect the abdomen for skin color, contour, pulsations, the umbilicus, and other surface characteristics such as lesions, rashes, and scars. So upon inspecting the patient's abdomen, there's no any lesions, rashes, masses, and scars found. So let's move on to the next steps, which is to auscultate the 4 quadrants of the abdomen to listen for bowel sounds using the diaphragm of the stethoscope. Using the systemic method, the right upper left upper lower left, then the right. Upon auscultating the patients, there's a rumbling or gurgling sounds, also known as burburgmy sounds, which indicates normal. Then after that, we need to auscultate again the patient's abdomen to listen for the vascular sounds. Using the bell of the stethoscope to listen for rotation. Then upon auscultating the patient's bowel sounds is normal. Then after that, we need to percuss the patient's abdomen for tones. Upon percussing the patient's abdomen, the tones are after that, we need to palpate lightly and deeply the patient's abdomen, and if the patient reports any pain or discomfort, then palpate that area. We need to palpate it lightly. The fourth then palpate it deeply. After that, we need to palpate for the kidney, liver, and spleen. And since the kidney and spleen is non-palpable, we need to move on to the palpating the liver. So upon palpating the liver, the patient's liver is smooth. Then after that, we need to assess for the patient's rebound tenderness in the patient's abdomen.
Saan man ang assign ang rebound tenderness? Saan ang assign? May rebound tenderness kayo na ay sakit na. I mean, isang test.
If the patient complains any pain or discomfort, after that, we need to palpate and auscultate the femoral pulses of the patient in the breast area.
Robot ako hapit naman.
Then
Roxing sign dito, roxing sign.
Then auscultate the femoral pulses using the bell pulses of the central lobe. Upon palpating and auscultating the patient's femoral artery, the patient's femoral artery is symmetrical and the pulses are brisk, grade 2, which is brisk and normal. And then after that, we need to assess the patient then we move the patients down and assist in a comfortable position. Then perform hand hygiene and document the findings of the assessment.